Lassa fever begins in silence, long before the first symptom appears, hidden in the small unnoticed corners of daily life. It is a viral hemorrhagic illness carried by a common West African rodent, the multimammat rat, and it spreads quietly through contaminated food, surfaces, or sometimes through contact with infected people. What makes Lassa fever frightening is not only the virus itself but how easily it can blend into ordinary life, going unnoticed until it becomes severe. In many regions, people live close to environments where these rodents roam freely, making the illness nearly impossible to predict or avoid completely. The virus enters the body, multiplies, and slowly begins to disrupt the immune system, setting off a chain reaction that becomes visible only when the first fever arrives. That is how the story of Lassa fever usually begins, slow, subtle, and often misunderstood. In the early stages, Lassa fever can appear almost identical to a common illness. Fever, weakness, headache, and mild aches feel like the onset of malaria, flu, or a simple viral infection. This makes it difficult for both families and doctors to suspect anything unusual during the first few days. But behind these mild symptoms, the virus is spreading through the bloodstream, affecting organs, blood vessels, and tissues. The immune system starts to react aggressively, leading to inflammation that can escalate quickly. As the illness progresses, more serious symptoms begin to appear. Sore throat, chest pain, persistent cough, vomiting, and diarrhea can develop, leaving the patient drained and dehydrated. In some cases, the eyes become swollen, the face puffs up, and internal bleeding begins. These symptoms signal the body's struggle to fight the virus. What makes Lassa fever so challenging is its unpredictability. Some people only experience mild symptoms and recover without ever knowing they were infected, while others develop severe forms that can lead to organ failure. The liver, kidneys, and spleen are particularly vulnerable, and when these organs begin to fail, the patient's condition becomes critical. In some cases, the virus affects the nervous system, causing confusion, tremors, or seizures. Hearing loss is one of the most common long-term complications, sometimes permanent even after recovery. The progression of Lassa fever depends on many factors: the strength of the patient's immune system, the amount of virus that entered their body, and how quickly they receive proper treatment. Lassa fever is not simply a medical condition, it is also a social and emotional crisis for the families affected. The moment someone begins to show severe symptoms, fear spreads through the household. Many communities are familiar with the illness and know how dangerous it can become. Relatives worry, not only for the patient's life but also for the possibility of infecting others. The emotional weight grows heavier when symptoms escalate to bleeding, confusion, or difficulty breathing. Families scramble to find transportation to hospitals, often traveling long distances while the patient's condition worsens. During times of outbreaks, hospitals may become overwhelmed, and health workers risk exposure as they fight to save lives. This emotional and social impact forms a major part of the story of Lassa fever. Once the patient reaches medical care, the real battle begins. Lassa fever has no widely available vaccine, so treatment relies on antiviral medications, supportive care, and rapid medical response. The primary treatment is a drug called ribavirin, an antiviral medicine most effective when given early, ideally within the first 6 days of symptoms. Ribavirin can significantly reduce the chances of severe complications, but it is not always available in all treatment centers. When given on time, it slows the virus's ability to replicate, giving the immune system a chance to regain control. Doctors monitor the patient closely, watching for signs of organ failure or internal bleeding. They provide fluids to prevent dehydration, oxygen if breathing becomes difficult, and medications to control fever, pain, or vomiting. Protecting healthcare workers is also extremely important. Lassa fever spreads through bodily fluids, which means doctors and nurses must wear protective gear, gloves, masks, gowns, to avoid exposure. Hospitals set up isolation areas to prevent the virus from spreading to other patients. In severe cases, patients may require intensive care, but in many regions where Lassa fever is common, resources are limited. This makes early recognition and early treatment even more critical. Every hour matters, and every delay increases the risk of severe complications. The emotional experience of recovery from Lassa fever is complex. Those who survive go through a long healing process. The body takes weeks to regain strength, and some patients experience prolonged fatigue, weakness, or persistent hearing problems. Families feel relief that their loved one survived but remain cautious, watching for lingering symptoms. In communities where the disease is known, survivors may face fear or stigma, even though they are no longer contagious after recovery. Education and awareness help families understand that survivors can return safely to normal life. Some people ask about natural or alternative treatments, but just like in many other viral hemorrhagic fevers, there is no herbal remedy, home treatment, or natural therapy that can cure Lassa fever or control its complications. The virus is too aggressive, and the illness can escalate too quickly. Relying on home remedies without hospital treatment puts the patient at risk of organ failure or death. However, supportive care at home before reaching medical help, such as giving clean water, oral rehydration solution, and paracetamol for fever, can help stabilize the patient temporarily. These supportive measures are not cures, they only buy time during the journey to medical care. Alternative approaches that truly matter for Lassa fever are preventive and supportive strategies. Storing food in rodent-proof containers, keeping homes clean, and reducing rodent presence help lower the risk of exposure. Educating communities about early symptoms encourages families to seek medical help immediately rather than waiting for the illness to worsen. Emotional support for the patient is also vital. Having someone nearby to speak calmly, provide water, and encourage them through the painful stages can make a difference. After treatment, giving the patient nutritious food, rest, and hydration helps the body recover. None of these supportive strategies replace medical treatment, but they help create a safer environment for healing. The story of Lassa fever is a story of regions battling an unseen enemy that hides in plain sight. It affects families, communities, and health systems. Yet despite its dangers, survival is high when treatment is started early. Many people recover fully and return to normal life. Continued research is working toward better treatments and hopefully a vaccine in the future. The biggest weapon against Lassa fever right now is awareness, knowing what it looks like, understanding how it spreads, and reacting quickly when symptoms appear. Lassa fever teaches us that even the smallest creatures in our surroundings can bring powerful consequences. It reminds us that early recognition is a form of protection. It shows that families, communities, and health workers all play a role in saving lives. And most importantly, it reveals that knowledge is the strongest alternative solution, the power to act fast, seek treatment, and support one another through the hardest moments. As long as awareness spreads faster than the virus, hope will always be greater than fear.